Welcome to LINNC Paris 2022, and I have with me today Professor Monika Killer. And we were just talking before about something that's fascinating, the implementation of artificial intelligence to increase the treatment of stroke. I want to talk a little bit about that.
Sure. This is a vision that I have since a while when these things came up, because stroke is in a treatment form that we do now with interventional therapy is very successful, and we treat a lot of patients very early and have a good success rate. But there is still 1/3 of the patients that don't make it in the proper time to our hospitals. And I think there is another reason why artificial intelligence and all these robotic systems come into account, because there is less and less experienced neurointerventionalists all over the world. And we need a lot of specialists to treat these kind of diseases. So there is a gap between need of the patients that get older and sicker and live longer and have more strokes maybe in the future, or hopefully not, but it could happen, so that we need to treat much more patients that we are able to do from the physician's standpoint of view. And I think the robotic systems at all can help us to overcome that, because the patient might not need to come to the hospital. We have now a very good telemedical system in our hospital installed. We have the outside hospitals connected, we can deal with them, we can see the patients, but we bring the patient to our ENG suite to do the thrombectomy, for example. This is time consuming, and each minute is a lot of brain cells that die on the way, although the best is done. And so we cannot improve the treatment when we are not quicker, and this is one of the things that can help. It's also a question of money and resources. We have to bring the patient back, so to get the beds free again in our hospital. There is stroke units in all these smaller hospitals outside, so the patient is well treated there. Besides, they don't have a thrombectomy option.
So I imagine that one of the critical issues is the quantity of cases that you treat, because you're not questioning the competence of those doctors in the regional hospitals. It's more how many times they get to do certain procedures.
Exactly. So you need to have centers of expertise, because it's such a high specialized therapy, and you need to do that every day, hopefully multiple times. And if you do 10 cases a year or a month, it's maybe not the same. And there is very good doctors outside, and you need them there, because you need to do the procedure and start the procedure with an experienced radiologist who can do the groin preparation, manage all the things that you have to do on the table, but maybe not the last expertise and the highest expertise that you need if there is a complication, if there is something very difficult or so. And this can be done by the expertise center with the robot system. So in my vision, each hospital has a robot. We have centers of expertise. They are on call and treat all the connected, whatever kind of hospitals and patients are there. So we can then treat patients who never would have access to this kind of therapy. And the people in the local hospitals have also the benefit that they get trained with all these cases.
So you concentrate experience, certain types of experience in one place, and then you depend on the larger experience of the population in the others.
Yeah, exactly.
Maximizing also the human resources.
Yeah. And I think you said artificial intelligence, because this is also something that implies that the robot do something itself, yeah? I think we will not be replaced, to be honest, yeah? But the robot helps us to be precise, to be quicker, to be more accurate, yeah? And this is maybe also for the patient's outcome, obviously very important.
And the gatekeeper to look at images and make a first selection.
Yeah.
Well, thank you very much for sharing that with us.
Thank you.